Hello, this is Dr. Michael Shear with the Learn Locator. This video is a clinical demonstration of a full arch fixed all-on-4 style implant case utilizing Zest Anchors CHAIRSIDE Attachment Processing Resin to attach the immediate load temporary bridge. Dr. Slim Bouchashaw is the surgeon and I am the restorative clinician. He has sedated our patient and is currently extracting her teeth. Additionally, he is elevating a generous full-thickness flap. Now at this point, after the flap elevation, Dr. Bouchashaw is placing the 3D printed nSequence bone foundation guide onto the bone. The guide should seat passively and has removable struts to help seat the guide properly. The guide is stabilized by using anchor pins. A 1.5 millimeter drill is placed into the guide sleeves and is prepared until a firm stop is reached. Anchor pins are placed one at a time until the guide is stabilized. Bite indentations, as shown here, assist in seating the guide during anchor pin placement. A strut is removed and alveoplasty is performed using the edge of the bone foundation guide to assist the surgeon in removing bone. A saw is beneficial to remove the bone in a clean cut in case it is needed for grafting later. Minor smoothing of the bone can be completed with surgical burrs, as shown here. Once the bone has been smoothed, the implant surgical guide can be placed directly on top of the bone foundation guide. Inside the surgical guide are master sleeves which will assist the surgeon in placing dental implants. The master sleeves guide the surgical drills in a sequential fashion to enlarge the osteotomy. It uses removable inserts that can be inserted and removed at the surgeon's will. Once that's been completed, the implant can be attached to the cylinder mount and placed through the guide. When the implant is placed through the guide, initially we like to use the surgical handpiece to place the implant, following it up with manual insertion via the torque wrench. Continuing to the other side, a similar sequential enlargement of the osteotomy, implant placement using the guided cylinders, as well as manual insertion. Dr. Bouchashaw typically likes to do the posterior implants first, just to get them out of the way. Once those have been completed, the anterior implants can be placed in a similar fashion. When the manual torque driver is inserted, it gives the surgeon a feel of insertion torque in a very finite fashion. As you see here, we like to test the implant torque value. Now you see the 4 cylinder mounts inside of the surgical guide fully in place. Little blue lines on the actual surgical guide will assist the surgeon in proper orientation of the dental implant. Once confirmed, the cylinder mounts can be removed from each individual implant. After all of the implants have been placed, the implant surgical guide can be removed from the bone foundation guide, giving you the full appearance of the implants in their final positions. Now at this point, we need to place the multi-unit abutments. In this picture, you're seeing a multi-unit rotation guide that goes on top of the bone foundation guide, which will assist the surgeon to orient the multi-unit abutments properly. The blue line assists with that alignment. And in the anterior, we're placing 17-degree multi-unit abutments, whereas in the posterior, we place 30-degree abutments. Either hand tightening down the abutments or utilizing the handpiece to tighten down the internal screws of the abutments is sufficient. The multi-unit rotation guide shows you the blue lines here. After the rotation guide has been removed, the temporary cylinders can be placed directly on top of the multi-unit abutments. Each cylinder has been pre-cut and labeled to assist in the placement of these titanium temporary cylinders. After all the cylinders have been placed, a silicone-style gasket is placed directly over the top of the cylinders. The nSequence guided bridge has been placed, and this image is showing you where the titanium cylinders are perfectly in the center of the pre-prepared holes. A silicone interocclusal record is also prepared by nSequence to facilitate in proper orientation of the patient's centriculation. While the patient is in full occlusion, Zest chairside attachment processing resin is injected into the channels prepared in the Guided Prosthetics. The chairside resin comes in a large 18 milliliter dual-barreled syringe that is utilized with your auto-mix injection system that you currently utilize for PVS impression materials. Resin is injected into all 4 channels to ensure enough resin reaches the temporary cylinders. Moving the patient while they're in full occlusion ensures that the bridge is properly seated. After completing the injection of the chairside material, a light curing unit can also be utilized to accelerate the set of the chairside material. Approximately 20 seconds of light cure is sufficient for each one of the cylinders. This will greatly enhance the ability of the clinician to expedite the process. This is the final appearance of the nSequence Guided Prosthetics utilizing the Zest chairside attachment processing resin. You'll notice that as we start to remove the screws, the prosthetic screws for this procedure, the Zest chairside attachment processing resin is strong enough to allow the clinician to very easily remove the bridge while ensuring that the temporary cylinders are secured to the bridge work. After the bridge work has been removed from the mouth, the surgeon will begin the suturing procedure for the final tissue conformation of the patient. At this point, I will take the bridge to the laboratory where I will begin the finishing and polishing procedures. As you see here, I really like to utilize the smaller chairside syringe, which is 4 milliliters in total volume, in conjunction with my Zest denture prep and polish kit to finish and polish all of the edges and contours of the full arch fixed temporary bridge. As you see here, I'm applying the mixing tip as well as the angled precise tip on the chairside dual barreled syringe, which will greatly enhance the addition of chairside around the cylinders. As a little precaution, if I have a few of the temporary cylinders which are held in just by a light to a moderate amount of resin, I freehand apply some more of the additional chairside attachment processing resin just to ensure I have enough strength to attach some of the laboratory components of the full arch fixed all-on-4 procedure. As you've noticed with some of my other videos with the Zest chairside attachment processing resin for removable indications, you'll also know that no additional bonding agent or primer is needed for either the initial pickup of the temporary cylinders or when I add additional chairside attachment processing resin here with the precise tip. Simply ensuring that you have a dry field, add additional chairside resin, and then light cure as you see here. After 20 seconds, you're ready to start trimming, which is very nice and distinctly different from acrylic resins. If you remember with some of the acrylic resins, such as the denture repair resins or things like products like Quickset or Temp Fix and whatnot, those are very nice products, but they do require a significant amount of time for autopolymerizing or these self-cure properties. So the chairside attachment processing resin is a composite resin. When you place it on top of existing chairside, you hit it with a light cure, it has a self-bonding property. What you're seeing here is I'm applying the polishing protectors to the undersurface of the titanium cylinders. This will ensure that in my further finishing procedures, I will ensure that I don't get any of the attachment processing resin on the inside of the temporary cylinders. I like to use these long guide pins to assist me in this procedure. Once the polishing protectors have been placed, I can then take additional chairside attachment processing resin with my smaller 4 milliliter syringe and give a very precise addition of additional material onto the intaglio or undersurface of this full arch fixed all-on-4 restoration. If you don't use polishing protectors, you have to be very careful with this phase. Although this is simplified because the chairside attachment processing resin is so easy to work with, but simply having these polishing protectors saves a tremendous amount of time. I do like to use one of these simple disposable brushes just to get the material to smooth out on the intaglio surface, minimizing the amount of finishing and processing I have to do at the end. Additionally, I take some of the chairside resin on that same mixing tip to fill in any of the other facial areas that have some voids, finishing it with a light curing unit. On the occlusal surface of the temporary bridge, you'll notice that I have these long pins. They are the 20 millimeter guide pins. I simply take the chairside resin and I flow it all the way around my cylinder and around the guide pin. I'm not worried about it going inside of the actual temporary cylinder at this point because these guide pins really make a snug fit against the titanium temporary cylinder. I don't want to necessarily fill in super fill in those voids in those areas, although I want to make it nice and smooth all the way around, ensuring that I have strength in this material. Similar to what I did on the other surfaces, I'm going to utilize the light curing unit, 20 seconds each cylinder to set the material. Using the trim and grind burr, I finish and polish the intaglio surface of the temporary bridge. I then take it under a pumice rag wheel to smooth and polish off all of the surfaces. It's important to ensure that you have the polishing protectors on your temporary cylinders at this point. Notice how the Zest chairside attachment processing resin simplifies the finishing and polishing of this full arch all-in-4 temporary bridge. When using Zest chairside attachment processing resin, the laboratory portion is typically completed within 30 minutes. This is contrasted by the fact that when you use acrylic resin, this procedure takes almost an hour and a half because of the time required for the acrylic resin to set. The bridge is torqued down to 15 Newton centimeters and occlusion is verified. The final nSequence guided prosthetic bridge is placed using the Nobel Biocare prosthetic screws. Notice how the aesthetics and simplification of the finishing procedures are greatly enhanced utilizing the Zest chairside attachment processing resin. This greatly enhances your clinical productivity and creates a real big wow factor with your patients. This is Dr. Michael Shear, and thank you for tuning in to another edition of Learn Locator. Special thanks to Dr. Slim Bouchachal for performing the surgery, Nobel Biocare, and Daniel Opp at nSequence.